Welcome to today's eye-opening exploration of heart disease, a silent but deadly adversary affecting millions worldwide. In this video, we'll delve into the intricate web of factors contributing to heart disease, understand its warning signs, and discover key preventive measures. Stay tuned to empower yourself with crucial insights that could safeguard your heart health and that of your loved ones. Let's embark on a journey to unravel the mysteries of heart disease together. What is heart disease? Heart disease refers to a class of diseases that affect the heart and blood vessels. It is often used interchangeably with the term cardiovascular disease, which generally refers to conditions that involve narrowed or blocked blood vessels that can lead to a heart attack, chest pain, angina, or stroke. How does heart disease happen gradually? Heart disease is a multifaceted condition influenced by a combination of lifestyle, genetic, and age-related factors. Here's a breakdown of how heart disease is caused by these elements. Lifestyle factors: unhealthy diet, diets rich in saturated fats, trans fats, cholesterol, and high levels of sodium contribute to the development of atherosclerosis. The excessive intake of these components leads to the buildup of plaque in the arteries, narrowing them and impeding blood flow to the heart. Lack of physical activity: sedentary lifestyles contribute to obesity, hypertension, and diabetes. Regular physical activity is crucial for maintaining a healthy weight, promoting cardiovascular fitness, and reducing the risk of heart disease. Smoking: tobacco smoke contains harmful chemicals that damage blood vessels, increase the formation of plaque, and contribute to blood clot formation. Smoking is a major risk factor for the development and progression of heart disease, significantly elevating the risk of heart attacks and strokes. Excessive alcohol consumption: drinking alcohol excessively can lead to high blood pressure and obesity, and weaken the heart muscle. It also contributes to an increased risk of irregular heartbeats and cardiomyopathy, a condition where the heart muscle becomes enlarged and weakened. Genetic factors: family history: individuals with a family history of heart disease are at a higher risk. Genetic predispositions may contribute to conditions such as high blood pressure, high cholesterol, and diabetes, all of which are risk factors for heart disease. Inherited conditions: certain genetic conditions, such as familial hypercholesterolemia, can result in abnormally high levels of cholesterol, increasing the likelihood of atherosclerosis and heart disease at an early age. Genetic variations: some people may inherit variations in genes that affect how the body processes and regulates cholesterol. These variations can influence the development of atherosclerosis and other cardiovascular conditions. Arterial stiffening: with age, blood vessels may lose elasticity, leading to increased stiffness. This can contribute to higher blood pressure, making the heart work harder to pump blood. Symptoms of heart disease: chest pain or discomfort, angina, characterized by chest pain or discomfort, signals an inadequate oxygen supply to the heart muscle. This sensation, often described as pressure or squeezing, can radiate to the arms, neck, jaw, or back. Prompt medical evaluation is essential, as angina may indicate underlying cardiovascular issues requiring attention and management. Shortness of breath: when it's hard to catch your breath, it might mean your heart needs attention. Shortness of breath can be a sign of heart disease. Don't ignore it. Talk to a doctor to understand what's happening with your heart and how to feel better. Dizziness or fainting: feeling dizzy or fainting could be a sign of heart disease. If it happens, don't ignore it. Talk to a doctor about how you're feeling. They can check your heart and help you understand what might be causing these symptoms, so you can stay well. If your legs, ankles, or feet are swelling, it might be a sign of heart disease. Don't overlook it. Talk to a doctor. They can check your heart and help you understand why it's happening, guiding you on steps to feel better and take care of your heart. These symptoms can vary in intensity and may not always manifest in the same way for everyone. It's crucial to note that experiencing any of these symptoms, especially chest pain or discomfort, should prompt. What to do when the primary symptoms occur at home? Immediate action is crucial when experiencing heart attack symptoms, chest pain, and shortness of breath. Call emergency services, 911 in the US, use local emergency numbers in other countries. At home, encourage rest, administer prescribed medications, and loosen tight clothing. Stay with the person, monitor symptoms, and await emergency responders. A swift response is paramount for positive outcomes in heart-related emergencies. Stay calm, try to remain calm and reassure the person experiencing symptoms. Encourage rest, have the person sit down and rest in a comfortable position. Take medications as prescribed. If the person has been prescribed nitroglycerin for angina, and it is readily available, help them take it as directed. Loosen tight clothing. If clothing is tight around the chest, loosen it to help improve breathing. Monitor symptoms. Keep a close eye on the person's symptoms and be prepared to provide information to emergency responders. Do not leave alone, stay with the person until emergency help arrives. Do not drive to the hospital. Emergency medical services have the necessary equipment to provide immediate care. Avoid driving to the hospital, as it may delay treatment. Tests to recognize heart disease. Doctors prescribe various tests for heart patients to assess their cardiac health. Common diagnostic tools include electrocardiograms, ECGs, to monitor heart rhythm, stress tests to evaluate cardiovascular endurance, and echocardiograms to assess heart structure and function. Blood tests measure cholesterol levels and cardiac enzymes. These tests aid in formulating precise treatment plans for individuals with heart conditions. CBC, complete blood count test. A CBC, complete blood count, test is a common blood test that provides information about the different types of cells in your blood. It includes several components, each with its own reference range. Red blood cell, RBC, count, the number of red blood cells in a specific volume of blood, ideal range, for adult males, around 4.5 to 5.5 million cells per microliter, MCL, for adult females, around 4.0 to 5.0 million cells/MCL. Hemoglobin, HB, level, the amount of hemoglobin, a protein that carries oxygen, in a given volume of blood, ideal range, for adult males, around 13.8 to 17.2 grams per deciliter, G/dl, for adult females, around 12.1 to 15.1 G/dl, child, 10 to 13 gm/dl, infant, 1 year -10 gm/dl. Hematocrit, HCT, the proportion of blood that is cellular, expressed as a percentage, ideal range, for adult males, around 38.3% to 48.6%, for adult females, around 35.5% to 44.9%. White blood cell, WBC, count, the total number of white blood cells, which are part of the immune system, ideal range, typically between 4,500 to 11,000 cells/MCL, adult, 5,000 to 15,000 cells/MCL, children, 6,000 to 18,000 infant, 1 year. Platelet count, the number of platelets, which are involved in blood clotting, ideal range, usually between 150,000 to 450,000 platelets/MCL. Mean corpuscular volume, MCV, the average volume of a red blood cell, ideal range, approximately 80 to 100 femtoliters, FL. These values can vary slightly depending on the laboratory and measurement units used. Additionally, what is considered normal may depend on various factors, including age, sex, and overall health. FBS, fasting blood sugar test, FBS, or fasting blood sugar, is a blood test assessing glucose levels after an overnight fast. The ideal FBS value is typically below 100 mg per deciliter, mg/dl. Values between 100 to 125 mg per deciliter may indicate prediabetes, and readings above 126 mg per deciliter on 2 separate occasions may suggest diabetes. Interpretation should consider individual health factors, and consulting with a healthcare professional is essential for accurate guidance and appropriate treatment. PPBS, postprandial blood sugar test, PPBS, or postprandial blood sugar, is a blood test conducted 2 hours after a meal to assess glucose levels. The ideal ppbs value is typically below 140 mg per deciliter, mg/dl. Elevated levels between 140 to 199 mg per deciliter may indicate impaired glucose tolerance, while readings above 200 mg per deciliter on separate occasions may suggest diabetes. Individual health factors should be considered, and consultation with a healthcare professional is crucial for accurate interpretation and appropriate guidance. A lipid profile test, also known as a cholesterol panel, is a blood test that measures various types of fats and cholesterol in your blood. It includes, total cholesterol is the sum of low-density lipoprotein, LDL, high-density lipoprotein, HDL, and very low-density lipoprotein, VLDL, cholesterol in the blood. The ideal total cholesterol level is typically below 200 mg per deciliter, mg/dl, with lower LDL and higher HDL levels contributing to cardiovascular health. Low-density lipoprotein, LDL, cholesterol is a type of cholesterol that transports cholesterol from the liver to cells. However, excessive LDL levels can lead to plaque buildup in arteries, increasing the risk of heart disease. The ideal LDL cholesterol level is typically below 100 mg per deciliter, mg/dl, with lower values considered healthier for cardiovascular well-being. High-density lipoprotein, HDL, cholesterol is a beneficial type of cholesterol that helps remove excess cholesterol from the bloodstream, reducing the risk of heart disease. The ideal HDL cholesterol level is often considered to be 40 mg per deciliter or higher. Higher HDL levels are associated with better cardiovascular health, as they help transport cholesterol away from the arteries. Triglycerides are a type of fat found in the blood, originating from the food we eat. Elevated triglyceride levels may contribute to heart disease. The ideal triglyceride level is generally considered to be below 150 mg per deciliter, mg/dl. Maintaining this level helps reduce the risk of cardiovascular issues and promotes overall health. Electrocardiogram, ECG or EKG. An ECG, electrocardiogram, is a medical test that records the electrical activity of the heart. It doesn't have an ideal value, but instead displays the heart's electrical patterns. Healthcare professionals analyze the ECG for abnormalities, irregularities, or signs of heart conditions. Normal ECG patterns can vary among individuals. The test helps diagnose and monitor heart issues, providing valuable information for healthcare providers. Any concerns about ECG results should be discussed with a medical professional for proper evaluation and guidance. Echocardiogram. An echocardiogram is a non-invasive medical test using sound waves to create images of the heart structure and function. Unlike traditional tests, an echocardiogram doesn't have specific, ideal values. Instead, it provides crucial information about the heart's chambers, valves, and overall performance, aiding in the diagnosis and management of various heart conditions. Interpretation of echocardiogram results is done by cardiologists, guiding healthcare professionals in assessing cardiac health and determining appropriate treatment strategies. ETT, exercise tolerance test, or stress test, evaluates the heart's response to physical exertion. It doesn't have an ideal value, but assesses cardiovascular function during exercise. The test monitors changes in heart rate, blood pressure, and ECG patterns, aiding in diagnosing heart conditions. Typically, a healthy response involves a gradual increase in heart rate with no abnormalities. Interpretation should consider individual health factors, and any concerns should be discussed with a healthcare professional for proper evaluation. Blood tests, check for specific markers indicating heart damage or disease. An angiogram is a medical imaging test that uses X-rays to visualize blood vessels. Unlike tests with specific, ideal values, an angiogram provides detailed images to assess blood flow, identify blockages, and guide interventions. It is crucial in diagnosing and treating conditions affecting blood vessels, such as coronary artery disease. The interpretation is done by specialists, often interventional cardiologists, to plan and execute procedures like angioplasty or stent placement. Angioplasty. In coronary angioplasty, a tiny wire mesh device called a stent is inserted into a blocked coronary artery to restore blood flow to the heart muscle. This procedure involves threading a deflated balloon with the stent through the blocked artery, inflating the balloon to compress the plaque, and leaving the stent in place to support the artery and prevent reblockage. Laser angioplasty. Laser angioplasty is a medical procedure that utilizes laser energy to treat narrowed or blocked blood vessels. During the procedure, a catheter with a laser tip is guided to the affected area. The laser emits intense light, vaporizing or breaking down plaque buildup, and restoring blood flow. This minimally invasive technique helps alleviate arterial blockages, enhancing overall vascular health and reducing the risk of cardiovascular complications. CT angiogram, CTA. A CT angiogram, CTA, is a non-invasive imaging technique that uses computed tomography to visualize blood vessels throughout the body. A contrast dye is injected into the bloodstream to highlight the vessels and X-ray images are taken. The detailed scans help diagnose conditions such as arterial blockages or aneurysms, providing valuable information for medical assessment and treatment planning. Atherectomy. Atherectomy is a medical procedure designed to remove plaque buildup from blood vessels, particularly in the arteries. During the procedure, a catheter with a specialized cutting device is advanced to the affected area. The device then shaves or vaporizes the plaque, restoring normal blood flow. Atherectomy is a minimally invasive technique used to treat arterial blockages, promoting improved vascular health and reducing the risk of cardiovascular issues. Open heart surgery. Open heart surgery is a complex medical procedure that involves accessing the heart through an incision in the chest to repair or replace damaged heart valves, arteries, or other cardiac structures. Surgeons temporarily stop the heart, using a heart-lung machine to maintain blood circulation. This intricate procedure is often necessary for treating various cardiovascular conditions and improving overall heart function. Pharmaceutical medications, drugs prescribed or recommended by healthcare professionals to treat specific medical conditions. These can include antibiotics, pain relievers, antihypertensives, and other medications. Lifestyle remedies. Lifestyle remedies for cardiovascular disease focus on adopting habits that promote heart health and reduce the risk of heart-related issues. These lifestyle changes often play a crucial role in managing and preventing cardiovascular diseases. Here are key lifestyle remedies. Diet. Dietary approaches to stop hypertension focuses on reducing sodium intake and includes a variety of nutrient-rich foods. Regular physical activity. Aim for at least 150 minutes of moderate-intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, combined with muscle-strengthening activities on 2 or more days. Maintain a healthy weight. Achieve and maintain a body weight within a healthy range to reduce the risk of obesity-related cardiovascular issues. Quit smoking. Smoking is a major risk factor for heart disease. Quitting smoking significantly improves cardiovascular health. Limit alcohol intake. Moderate alcohol consumption may have cardiovascular benefits, but excessive intake can contribute to heart problems. Limit alcohol to moderate levels or avoid it altogether. Manage stress. Practice stress-reducing techniques such as meditation, deep breathing exercises, yoga, or mindfulness to manage chronic stress. Adequate sleep. Aim for 7 to 9 hours of quality sleep per night. Lack of sleep can contribute to cardiovascular issues. Regular health checkups. Regularly monitor blood pressure, cholesterol levels, and other cardiovascular risk factors. Early detection and management are crucial. Stay hydrated. Drink an adequate amount of water, as dehydration can strain the heart. Limit processed foods and added sugars. Choose whole, unprocessed foods and minimize the intake of foods high in added sugars and unhealthy fats. Social connection. Cultivate strong social connections, as having a supportive social network can positively impact heart health. Herbal remedies. Garlic. garlic offers cardiovascular benefits by potentially lowering blood pressure, improving cholesterol profiles, and possessing antioxidant and antiplatelet properties. These effects contribute to a reduced risk of heart disease, making garlic a valuable addition to a heart-healthy diet. Turmeric, with its active compound curcumin, offers cardiovascular benefits by reducing inflammation, acting as a potent antioxidant, enhancing endothelial function crucial for heart health, lowering risk factors like oxidative stress, and potentially improving lipid profiles. Its multifaceted properties contribute to a healthier cardiovascular system. Fenugreek seeds benefit cardiovascular health by lowering cholesterol levels, regulating blood pressure, exhibiting anti-inflammatory and antioxidant properties, and aiding in blood sugar control. Chia seeds, packed with omega-3 fatty acids, fiber, and antioxidants, chia seeds can help lower bad cholesterol, LDL, and increase good cholesterol, HDL. Sunflower seeds, high in vitamin E, magnesium, and selenium, sunflower seeds contribute to heart health by promoting good cholesterol levels and reducing inflammation. Pumpkin seeds, pepitas a good source of magnesium, potassium, and antioxidants, pumpkin seeds may help regulate blood pressure and support heart function. Sesame seeds, contain heart-healthy monounsaturated and polyunsaturated fats, along with fiber and various minerals that support cardiovascular health. Green tea provides cardiovascular benefits by improving heart health. It contains antioxidants that reduce inflammation, lower blood pressure, and enhance cholesterol levels. The catechins in green tea may protect against arterial damage, promoting overall cardiovascular well-being and reducing the risk of heart disease. Isabgol, or psyllium husk, benefits cardiovascular health primarily through its ability to lower cholesterol levels. It binds to cholesterol in the gut, reducing its absorption and aiding in its elimination. By improving lipid profiles, isabgol may help reduce the risk of cardiovascular disease and support heart health. Exercise is a great way to improve heart health. Before starting a new workout routine, especially for those with heart issues, it's important to consult healthcare providers. Cardiovascular exercises, like walking or cycling, are generally recommended for a healthy heart. Aerobic exercise, walking, a low-impact exercise that can be easily incorporated into daily routines. Flexibility and stretching, yoga, helps improve flexibility, balance, and relaxation. Tai Chi, a gentle exercise that combines movement and meditation, promoting balance and flexibility. Swimming, a low-impact exercise that is gentle on the joints and provides a full-body workout. Meditation and deep breathing, stress reduction techniques can positively impact cardiovascular health. Always consult a healthcare professional before initiating or making significant changes to your exercise routine, especially for personalized guidance and to ensure your safety and well-being. Interval training, high-intensity interval training, hit short bursts of intense exercise followed by periods of rest. Should be approached cautiously and under supervision. Elliptical training, provides a low-impact option that engages both the upper and lower body. Dancing, fun and effective, dancing can be a good way to get the heart rate up. Cycling, stationary or outdoor cycling can be an effective way to improve cardiovascular fitness. Bodyweight exercises, squats, lunges, and modified push-ups can contribute to muscle strength. Balance exercises, help improve stability and reduce the risk of falls. Dark chocolate, in moderation, contains flavonoids, which may have heart protective effects. Choose chocolate with at least 70% cocoa content. Legumes, excellent sources of protein, fiber, and various nutrients without the saturated fat found in some animal proteins. Examples: beans, lentils, chickpeas, and peas. Nuts and seeds, rich in healthy fats, fiber, and antioxidants. Examples: almonds, walnuts, chia seeds, and flax seeds. Tofu and tempeh, These plant-based protein sources are low in saturated fats and can be incorporated into various dishes. Food remedies. A heart-healthy diet for individuals with cardiovascular disease should focus on nutrient-rich foods that support overall heart health. Here are some foods that are generally considered good for cardiovascular heart patients. Whole grains provide fiber, vitamins, and minerals, and may help lower cholesterol levels. Examples: quinoa, brown rice, oats, and whole wheat. Proteins. When selecting proteins for individuals with cardiovascular disease, it's important to choose options that are lean, low in saturated fats, and heart-healthy. Here are some protein sources that are generally considered beneficial for cardiovascular health. Fatty fish, rich in omega-3 fatty acids, which have been shown to promote heart health. Examples include salmon, mackerel, trout, and sardines. Cod liver oil. Cod liver oil is beneficial for cardiovascular health due to its rich content of omega-3 fatty acids, which may reduce triglycerides, improve blood vessel function, and potentially lower blood pressure. Additionally, it provides essential vitamins A and D, contributing to heart health. However, consulting a healthcare professional is crucial for personalized advice. Eggs. Rich in high-quality protein, eggs can be part of a heart-healthy diet. Limit intake of egg yolks due to cholesterol content. Lean red meat. If choosing red meat, opt for lean cuts such as sirloin or tenderloin, and trim visible fat to reduce saturated fat content. Low-fat dairy. Choose low-fat or fat-free dairy options such as yogurt, milk, and cheese for protein without excessive saturated fats. Quinoa. A complete protein source with essential amino acids, quinoa is also rich in fiber and other nutrients. Skinless poultry. Lean cuts of chicken or turkey without the skin are lower in saturated fats and can be a good source of protein. Soy products. Edamame, tofu, and soy-based products are good sources of protein with potential cardiovascular benefits. Vegetables. A heart-healthy diet rich in vegetables can provide essential nutrients, fiber, and antioxidants that contribute to cardiovascular health. Here are some vegetables that are generally considered good for individuals with cardiovascular disease. Leafy greens, e.g., spinach, kale, Swiss chard rich in vitamins, minerals, and antioxidants. Leafy greens can support heart health. Asparagus contains fiber, folate, and antioxidants, contributing to a heart-healthy diet. Bell peppers, high in vitamin C and A, as well as fiber, bell peppers contribute to heart health. Broccoli contains sulforaphane, a compound with potential cardiovascular benefits, and is high in fiber. Brussels sprouts, high in fiber, vitamins, and antioxidants. Brussels sprouts can be beneficial for heart health. Carrots, packed with beta-carotene and fiber, carrots are a nutritious choice for heart health. Cauliflower, a versatile vegetable that is high in fiber and contains compounds with potential heart benefits. Spinach, rich in potassium, magnesium, and iron, spinach is a nutrient-dense choice for heart health. Sweet potatoes, packed with vitamins, especially vitamin A, and fiber, sweet potatoes are a nutritious choice. Tomatoes, rich in lycopene, which may have cardiovascular benefits and a good source of vitamins C and A. Zucchini, low in calories and high in vitamin C and A, zucchini is a nutritious addition to meals. Limited sodium, reduce salt intake to manage blood pressure. Fruits, several fruits are considered beneficial for cardiovascular health due to their nutrient content, including antioxidants, fiber, vitamins, and minerals. Here are some fruits that are generally considered heart-healthy: berries, e.g., blueberries, strawberries, raspberries rich in antioxidants, vitamins, and fiber. Berries may contribute to improved heart health. Apples, high in soluble fiber, apples can help lower cholesterol levels and support heart health. Avocado contains monounsaturated fats, which are heart-healthy fats, along with potassium and fiber. Bananas, rich in potassium, bananas help regulate blood pressure and support heart function. Cherries contain anthocyanins, which have antioxidant and anti-inflammatory properties. Grapes. Resveratrol, found in grapes, has antioxidant properties that may benefit the heart. Kiwi, a good source of vitamins C and K, potassium, and fiber, contributing to cardiovascular health. Oranges and citrus fruits, packed with vitamin C and fiber, citrus fruits may have positive effects on heart health. Pomegranate, contains antioxidants and may have anti-inflammatory effects, potentially benefiting heart health. Watermelon, rich in lycopene, vitamins A and C, and citrulline, watermelon may support heart health. Essential gadgets for heart health. While gadgets can be helpful for monitoring and maintaining cardiovascular health, it's important to note that they should complement, not replace, professional medical advice and regular checkups. Here are some gadgets that may be beneficial for cardiovascular health. Blood pressure monitor. Automatic blood pressure monitors can help you keep track of your blood pressure at home. Regular monitoring is essential for managing hypertension. Bluetooth-enabled blood glucose monitor. For individuals with diabetes, maintaining optimal blood glucose levels is crucial for heart health. Bluetooth-enabled monitors can sync with mobile apps to help track and manage blood glucose levels. Fitness tracker. Devices that track your physical activity, such as the number of steps taken, distance traveled, and calories burned, can encourage regular exercise, which is crucial for cardiovascular health. Heart rate monitor. Wearable fitness trackers or smartwatches often include heart rate monitoring features. These can help you keep track of your heart rate during exercise and throughout the day. Portable oxygen concentrator. If you have a respiratory condition, a portable oxygen concentrator may be necessary to ensure you receive sufficient oxygen, which is crucial for heart health. Remember, it's important to consult with a healthcare professional before using any health-related gadgets, especially if you have pre-existing medical conditions. These devices can be valuable tools for self-monitoring, but they are not a substitute for professional medical advice and care. Pulse oximeter. This device measures the oxygen saturation in your blood, providing information about how well your heart is pumping oxygen to the rest of your body. Sleep tracker. Quality sleep is essential for overall health, including cardiovascular health. Some wearable devices and apps can monitor your sleep patterns and help you identify areas for improvement. Smart Body Fat Scale. A smart scale can measure not only your weight but also other metrics like body fat percentage and muscle mass. Maintaining a healthy weight is important for heart health. Smartwatch ECG feature. Some smartwatches have electrocardiogram, ECG, features that can provide insights into your heart's electrical activity. This can be useful for detecting irregular heartbeats. As we wrap up our journey through the complexities of heart disease, let's commit to proactive heart health. Awareness is the first step, and by sharing this knowledge, we contribute to a healthier community. If you found our video valuable, please show your support by liking, sharing, and subscribing. Together, let's champion heart health, inspiring positive changes for ourselves and those around us. Thank you for joining us. Here's to a heart-healthy future for all.